What's up everyone, it's Dr. Andrew. Today we're going to talk about the 4 main reasons why you probably have low back pain. Okay, so honestly there's probably more than 4 reasons why you have back pain, but these are the 4 most common reasons why you might have low back pain. Number 1, you're not exercising or you're just really weak, okay? So to be honest, I see this a lot, especially with some of my patients. They come in, they've got a big gut, they're very weak, okay, and they're like, why does my back hurt? And I'm like, well, you're not very strong, okay? And literally, if you want to be able to lift things, if you want to be able to move properly, you got to have muscles to be able to do that. So there's number 1, is you're weak and you're not exercising, okay? Specifically in the abs, okay, in the abdominal muscles, in the glutes, okay, and in the lower legs. So that's number 1. Number 2, you are exercising, but you're probably doing it with poor form, or you're strengthening bad habits. And what do I mean by that? You're strengthening muscles and you're doing movements improperly. And so now so for example, your abs, your transverse abdominis muscles have to be strong for you to be able to lift things and not have back pain. But a lot of times people don't know how to contract those TA muscles, and instead they're using all right here, the rectus abdominis, okay? It's good to have these muscles be strong, but you also have to have your external obliques, your internal obliques, your TAs have to be strong as well. And they just don't know how to do that. So they're doing these ab workout exercises that are really advanced, and they're just using their rectus abdominis, rectus, they're doing everything with just the rectus, and they're not actually using the girdle of the low back and of the trunk to stabilize their spine, and that is extremely weak. So they're strengthening muscles that need to be strengthened, but they're not strengthening the correct muscles, or they're doing these exercises with incorrect form. Another example of exercising with bad form is when people do all these big, heavy Olympic lifts, but they don't have very good form. For example, the deadlift, the squat, okay, power cleans. No offense, but a lot of my CrossFit people, you know, you are doing these exercises maybe for the first time, and you maybe don't know how to do them properly, and you don't know which muscles you're supposed to work, okay? So now it's great. I love that you're getting out, you're strengthening your body, okay? But a lot of times you don't do it with great form, and then you injure something. I'm not saying that CrossFit is bad, okay? I really love CrossFit, and that's going to be a whole nother video that I'm going to do on CrossFit. So I don't want to get into CrossFit, but generally people, when they start getting into exercising, that's great. I love it, but a lot of times they need a little bit of direction on how to do it properly with good form to avoid injury. And that's where going to a physical therapist can really help, because they can tell you how to do things properly to avoid injuries to the low back. The third reason why you probably have low back pain is poor posture and bad habits, okay? And what do I mean by that? Well, a lot of us do flexion, flexion, flexion of the spine all the time. We're always flexing to bend over to get water, to bend over to grab something. We are literally always flexing the spine, when in reality the spine needs some extension, okay? So when we have really poor posture, when we're not bending and moving our body the correct way, then yes, we're going to have low back pain, okay? And I have a video on that, on how you can improve your posture and what you need to look for to try to avoid back pain. And the fourth reason why you probably have low back pain is you have an actual injury. Maybe you lift something, maybe you even did it the proper way, but it was just too much. Now you have a hernia. Maybe you have spondylolisthesis of the back. Maybe you have arthritis. Maybe you're a little older and you have arthritis of the back, okay? All these actual mechanical injuries to the spine can be giving you low back pain. Now, if you have these issues, then you need to go see a doctor. You need to go see a physical therapist, okay? And I'll also post a video on just some very good general strengthening exercises you can do that literally anybody can do to help strengthen the low back and decrease pain in the low back. If you have a bulging disc, if you have arthritis, if you have spondylolisthesis, any of these things, these exercises will be fine to do to be able to strengthen your back, give yourself a strong core, and avoid further injury to your low back. Well, those are the 4 leading reasons why you probably have low back pain. That's it for today. If you have any questions, please leave a comment, and Like always, please subscribe to my channel, and we'll see you in the next video. Bye.